Hey guys, Dr. Andy here. Today we are joined by Miss Katie. Today we are going to talk about why your mid-back might be causing your shoulder mobility problems, especially if you are attempting to do a overhead squat and you can't get low and you're having a lot of shoulder problems. Why? What can you do about that? What's causing the problem? And how do you fix it, right? So do me a favor, Miss Katie, face that direction for me. Really quickly, it's something called regional interdependence. Regional interdependence just means that, just like the song that we sang as a kid, your backbone's connected to your hip bone. Well, your backbone in this case is absolutely connected to your shoulder bones, all right? So anytime that we have a loss of mobility in your thoracic spine, it will translate into a big problem in our shoulders. So I can't tell you how many patients come in complaining of a shoulder problem, and we'll look and evaluate the shoulder and it is perfectly fine, and we will discover a problem right here in the mid-back. So mid-back is responsible for a lot of our body mobility, and if we have any mobility problems, meaning it gets stiff, it gets too tight, maybe you're a desk worker as well as going to the gym and working out all the time, you can develop a lot of problems and loss of mobility here in the mid-back. And when this happens, your body has to make up for it somehow. You still have to move. So it translates into excess motion and instability in the shoulder. And when you get instability in the shoulder, you start to develop some shoulder problems, okay? So Miss Katie, go ahead and go to that overhead arm squat position, okay? So a lot of times we will have a lot of our patients, they'll assume this position and we physically can't get our arms back. You can't even get into that position for a good overhead squat in order to be nice and stable through your shoulders because of a loss of mobility right here in the mid-back. You go ahead and relax. So if you are dealing with a lot of what you think is shoulder stability issues, especially with an overhead squat in the gym, many times it's coming from right here in the mid-back. So at home, you could always try a foam roller or obviously a cat camel stretch, anything to increase some mobility right here in your thoracic spine. And if that doesn't work, give us a call. We'll help you out and we will make sure that that mid-back is moving the way that it's supposed to. If you have any questions, send them our way, and always remember to live with passion, not pain.